How do we treat allergies? Why is it more beneficial to manage this condition early on? You might have already viewed previous allergies concepts presented at Wiki Allergies animation. It looks like allergies do not just occur at the nasal cavities, the sinuses, or the skin where there are sensation of itchiness and pain. It might already develop inside many organs, mucosal linings, and submucosal connective tissues that do not have similar sensations to the nose or the skin. Itchiness and pain on the outside might just be the signals that alert us to look deeper inside, because there are much more far-fetched consequences of organ inflammation if not detected and managed early on. Managing this type of allergic or type 2 inflammation might be more complicated than we thought. Once the body develops inflammatory cells that react to aeroallergens, there is not much we can do with the current technologies to stop those reactions from happening, since we are continuously exposed to those aeroallergens in the surrounding environment by the simple action of breathing. Inflammatory cells are constantly made in billions from the bone marrow and lymph nodes and are constantly dissipated throughout the body every day. Once reactions occur between those aeroallergens and the immune cells, the inflammation would continue to progress due to the presence of abundant allergy cells along the airways, plus the continuous action of breathing in allergens or pollutants from the air. Furthermore, when the original sites of inflammation are not controlled, allergy cells would continue to proliferate. It means the body would ramp up production of those cells into inflammatory sites. With that said, you would see inflammation progressively get worse, slowly at first, then likely exponentially later on. Chronic inflammation of the mucosa or the skin would lead to dermal, mucosal, or barrier damage. Hence the exposure of underlying inflammatory cells directly to dead cells, genetic materials, and microbes that colonize there. This chronic interaction of billions and billions of microbes, genetic materials, and inflammatory cells might one day lead to the development of new autoimmune diseases. The possibility of breaking of tolerance and development of autoimmune diseases have been already observed in many gut inflammatory diseases and classic rheumatic fever, in scenario called bacteria mimicry. Barrier damages in many cases could also stimulate the proliferation of the very toxic white blood cells called eosinophils. This type of cells should not be abundant in modern days when parasitic infections are not common. Continued proliferation of eosinophils in the absence of parasitic infections might one day lead to infiltration of these cells inside organs that it would not normally colonize there. This would lead to chronic organ inflammation and function loss. Managing allergic inflammation should include multiple approaches simultaneously. Interventions should include minimizing exposure by decreasing allergens and pollutants in the air so inflammatory cells are less stimulated. It would also require aggressive barrier damage repair to disperse inflammatory cells away from the inflammatory sites. By doing so, it might minimize the chronic interactions between inflammatory cells, microbes, dead cells, and genetic materials, so lessen the possibility of breaking of tolerance. Barrier damage repair might also decrease the proliferation of eosinophils, which in turn would decrease inflammation. Since inflammatory cells are constantly made in the bone marrow, treatment would also require a method to distract those cells away from the body linings by homing and redirecting them elsewhere. Fortunately, with modern technologies, we now have several ways to block the proliferation of those inflammatory cells quickly to fasten the control of inflammation by using monoclonal antibodies. Those biologics injections would quickly block inflammatory cell signals directly. This affords us the ability to achieve control of overall inflammation much faster with better success rate. This could also afford us to lessen the risk when trying to redirect inflammatory cells elsewhere. Treating allergies should not be simply treating the nuisance of itchiness or pain in the sinuses or the skin. Those are just the tip of the iceberg. There might be much more itchiness inside the body if allergies are not managed early enough. The inside itchiness is the one that is much more damaging, but we just do not feel that itchiness signals. So if you have allergies, come talk to your local allergist immunologist. We are skillful in understanding and utilizing a variety of ways to control inflammation.